I could start with you, Bharat. How do we fix the NHS, and is there any good news?
Oh, the NHS is one of the best in the world if only we would manage it right and fund it right. So how do you fix it? The first thing is this: medicine costs money. And if you were to invest, and we have not invested in public health preventative measures, then you create fewer patients. Although this preventative action takes about 20 years to grow to fruition, it is the best solution possible, because when you have a healthy population, they go to work, and when they go to work, they pay taxes, and when they pay taxes, they contribute to the exchequer. Therefore, having a healthy population should be very important, and therefore you do your preventative medicine. Going forward, the NHS, most people don't know this, that further to the private finance initiatives, we are bleeding a lot of money to these. We are mortgaged out of existence to these private companies who own the hospital buildings, to whom we have to pay a colossal amount of our money because of those PFI initiatives. And what we can do about what those initiatives are, I don't know. The one other bit that we must do also is, of course, we have these artificial barriers called the purchaser-provider split, which is trusts compete with themselves to provide services. Instead of competing, it is better to work collaboratively. We are not a chain of supermarkets competing with each other, and therefore it is better to say we will work together to produce the best for our country, for all the patients all over the country. There are a few more things I would say, but I'll break for now.
Go on, thank you. Jess, what do you think? Where are we at with the NHS?
I'm sorry, but it's absolute nonsense that the NHS is underfunded. The UK, I believe, is the 6th highest healthcare spending out of all the OECD countries. It's consistently rising. This idea that there's this elaborate scheme that the Tories are trying to underfund the NHS to privatize
They have underfunded
is a
it.
conspiracy
Have a look at it
theory,
yourself.
and it shouldn't be taken seriously. It's an absolute
joke. Look at it yourself. If you look at all the fellow European Union countries, Germany, France,
We're 6th
Italy,
highest
Spain,
out of 32 countries. I think it's an actual...
As a product of GDP, we invest less.
Let Jess finish, Barrett, because you did have your say. Jess, I mean, is he saying that you're wrong? Are we spending more than other countries?
We're the 6th highest out of 32 other countries. It's a product of the system. It's a system that's wrong. I wish that healthcare companies acted like Tesco and Asda. That would actually produce a better product if we treated patients like consumers. I think then we have a healthcare system that prioritises the patients, prioritises the people. You know, during the COVID pandemic, we were told to protect the NHS. Why doesn't our healthcare system protect us? I think we completely need to change our mentality around the NHS, because quite frankly, it's a cult mentality. The NHS needs to be abolished.